Hello viewers, welcome to my channel. Today I am going to make a video about medicines which are commonly used in pediatrics. The reason for making this video is that I have noticed that there is not many videos or material regarding this, and for all the pediatricians and medical students who wants to be a pediatrician should know that it is very important to know the doses of medicines, as it is not like adult medicines. So let's get started. The first medicine is ampicillin. So it is an antibiotic. Here I will not just give you doses, I will give you a little overview of the medicine and then I will tell you about the doses. So let's see. uh, as we can see, the first drug is ampicillin and it is an antibiotic. Let's study about it and get a short summary. Ampicillin, a broad spectrum penicillin type antibiotic used to treat bacterial infections like respiratory, UTI, gastro and meningitis. It works by inhibiting bacterial cell wall synthesis. It is a very common neonatal antibiotic, and it is first line. Let's discuss the doses. But for birth asphyxia or upper respiratory tract infection, the dose will be 100 mg per kg per day, and the injection strength and dilution will be 500 mg into 5 ml. And for sepsis, the dose will be 200 mg per kg per day TDS, and for meningitis, the dose will be 300 mg per kg per day TDS. Let's see our second drug, which is cefotaxime. These are the brand name of the drug cefotaxime. It is another neonatal antibiotic which is also first line and given very commonly. Let's see short review. Cefotaxime, a third generation cephalosporin antibiotic used for serious bacterial infections, for example pneumonia, sepsis, meningitis. It works by inhibiting bacterial cell wall synthesis and is effective against many gram-negative and some gram-positive bacteria. So cefotaxime gives us gram-negative cover, while ampicillin gives us gram-positive. The next drug is benzyl penicillin. It is not very commonly used these days, but still we will discuss the dose. The dose for respiratory tract infections, diphtheria and tetanus is 1 to 2 lakh units per kg per day in 4 to 6 hours, 4 to 6 hourly. For meningitis, 3 to 4 lakh units per kg per day, again 4 to 6 hourly. Now let's see our next medicine, which is also an antibiotic, augmentin. Amoxicillin, a very common antibiotic used for upper respiratory tract infections. For sepsis, the dose is 200 mg per kg per day. For meningitis, it's 300 mg per kg per day, and the oral dose is 30 to 50 mg per kg per day. And the strengths of different suspensions are 156 mg by 5 ml. Double strength is 312 by 5 ml, and the most upper strength is 457 mg by 5 ml. The tablets concentrations are 375 mg, 625 mg and 1 gram. Next antibiotic is ceftriaxone, very commonly used antibiotic. The dose for ceftriaxone for diarrhea, we will give 50 mg per kg per day, OD or BD. For pneumonia, 75 mg per kg. For enteric fever or typhoid, 85 mg per kg. And for meningitis, 100 mg per kg. So these are the doses of ceftriaxone. It is also a third generation cephalosporin antibiotic used to treat severe infections like pneumonia, meningitis, gonorrhea, and sepsis. It works by inhibiting bacterial cell wall synthesis and has a long half-life, allowing once daily dosing. But it's mostly used BD. The next is ceftazidime. It is also very commonly used in neonates and infant. Ceftazidime, a third generation cephalosporin antibiotic, effective mainly against gram-negative bacteria including Pseudomonas aeruginosa, used in serious infections like pneumonia, sepsis, and UTI, works by inhibiting bacterial cell wall synthesis. Let's check the next medicine, which is cefepime. Cefepime, a fourth generation cephalosporin antibiotic with broad spectrum activity. So it's a new drug against both gram positive and gram negative bacteria, including Pseudomonas aeruginosa, used for severe infections like pneumonia, sepsis, febrile neutropenia. Inhibits bacterial cell wall synthesis. It's a very good drug. Now see the next drug, which is cefixime. Again very commonly used for respiratory tract infections. An oral third generation cephalosporin antibiotic used for mild to moderate infections like respiratory tract infections, otitis media, UTI, and gonorrhea. Effective mainly against gram-negative bacteria, works by inhibiting bacterial cell wall synthesis. The dose of cefixime in upper respiratory tract infection 10 mg per kg per day. For enteric fever is double. And the concentration strength of syrup is 100 mg and 200 mg. The next antibiotic is cefuroxime. Guys, it's very important to know about these antibiotics and their doses, because you will be using them a lot in your peds practice. They are not very commonly used in adult patients, but in peds they are important. Cefuroxime, a second generation cephalosporin antibiotic used for respiratory tract infections, sinusitis, UTI, and skin infections. Active against both gram positive and negative, works by inhibiting cell. So again, cephalosporin, it is good for skin infections too. Let's see our next. Let's first see the doses. The IV dose is 100 mg per kg per day. Injection formulations are 250 mg and 750 mg. The oral dose is 30 mg per kg per day BD. Syrup 125 mg by 5 ml. Next antibiotic is ceftazidime. Let's check it out. Ceftazidime, a first generation cephalosporin antibiotic used for mild to moderate infections like skin, respiratory, urinary, and ENT infections. Primarily effective against gram positive, acts by inhibiting cell wall synthesis. So it can also be used for mild infection. It is not helpful in severe infections. Next is cefoperazone. Cefoperazone, a third generation cephalosporin antibiotic with strong activity against gram-negative bacteria, including Pseudomonas aeruginosa, often used for intra-abdominal respiratory and UTI infection, works by inhibiting bacterial cell wall synthesis, sometimes combined with sulbactam. So it's sometimes used with sulbactam to be overcome beta lactamase resistance. The very common brand name for this injection is Tusum. It's a very good antibiotics when it's used with sulbactam. Next is cefaclor. Cefaclor, a second generation cephalosporin antibiotic used to treat respiratory tract infections, otitis media, skin infections, and UTI, effective against both gram positive and some gram negative bacteria, works by inhibiting bacterial cell wall synthesis. The dose of cefaclor is 20 to 30 mg per kg per day. It is given TDS drops. Strength are 50 mg per ml. Syrup is 125 and 250 mg. The next is gentamicin. The dose of gentamicin is 4 mg per kg per day. It is very good for gram negative cover and it has a very good result, and these days the use of gentamicin has become very common. It's an aminoglycoside antibiotic used for serious gram-negative infections including sepsis and pneumonia. It works by inhibiting bacterial protein synthesis. It is bactericidal but has risks of nephrotoxicity and it has the very common side effects of aminoglycosides are nephrotoxicity and ototoxicity. Another very commonly used aminoglycoside is amikacin. The next one is amikacin. It is also an aminoglycoside, very commonly used. The dose for amikacin is 50 mg per kg per day, and it also comes in syrup formulation, which is 100 mg per 2 ml. The next is streptomycin. It is also an aminoglycoside. The dose is 20 to 40 mg per kg per day, and it is given intramuscularly. The next drug is ofloxacin. It is a fluoroquinolone antibiotic used to treat respiratory, urinary, gastro, and skin infection. It works by inhibiting bacterial DNA gyrase and topoisomerase IV enzymes essential for DNA replication, effective against many gram-negative and some gram-positive bacteria. Ofloxacin. It is also a good antibiotic. The dose for ofloxacin is 10 mg per kg per dose, and the tablet is 200 mg and 400 mg fold. Next is Novidate, ciprofloxacin, very common drug. The oral and IV dose is 20 mg per kg per day. Syrup formulations are 125 mg and 250 mg. The next is Claricid. Erythromycin. It is very commonly used for respiratory tract infections, mostly lower respiratory tract infections. And the dose of clarithromycin oral and IV is 15 mg per kg per day. Syrup formulations are 125 mg by 5 ml, 250 mg by 5 ml. It comes in drops form 2, which is 62.5 mg per dropper, and dropper is 2.5 ml. Next is Azomax, azithromycin. Azithromycin, a macrolide antibiotic used for respiratory tract infections, skin infections, STI, and atypical pathogens, Mycoplasma chlamydia. It works by inhibiting bacterial protein synthesis. 50S ribosomal subunit has a long half-life, allowing once daily short course dosing. It is given OD. Let's check the dose. The dose is 10 mg per kg per day. The syrup formulation is 200 mg by 5 ml. The next is phosphomycin. It has very good result in UTI, urinary tract infections, even pyelonephritis. It has a good result. A broad spectrum antibiotic primarily used as single dose treatment for uncomplicated UTIs. It works by inhibiting bacterial cell wall synthesis at an earlier step than beta-lactams, targeting enol pyruvyl transferase, effective against gram-positive and gram-negative bacteria. The dose of phosphomycin is 25 mg per kg. It is given 6 hourly, 4 times a day. The syrup formulation is 250 mg by 5 ml. The capsule is 500 mg, which is also given 6 hourly. It also comes in sachet, 3 gram sachet, which is given just once. The next is vancomycin, which is used for complicated infections. It is a very strong antibiotic. They are glycopeptide antibiotic used for serious gram-positive infections, including MRSA, C. difficile colitis, and endocarditis. It works by inhibiting bacterial cell wall synthesis by binding to DALA terminus of cell wall precursors, risk of nephro and ototoxicity, and red man syndrome if infused too quickly. The dose of Vanco for septic patients 45 mg per kg per day, and for meningitic 60 to 80 mg per kg per day. Meropenem, which is Meronum. The brand names are Meronum and Merocon. Meropenem, a broad spectrum carbapenem antibiotic used for severe or resistant infections, including intra-abdominal, CNS, hospital acquired infections, effective against gram-positive, gram-negative, and anaerobic bacteria, works by inhibiting bacterial cell wall synthesis, resistant to most beta-lactamases. The dose of meropenem is 60 to 120 mg per kg per day. For sepsis it's 60, and for meningitis it's 120 mg. The next is Tynum, which is imipenem plus cilastatin. This is used when other antibiotics are not effective. Imipenem is a broad spectrum carbapenem antibiotic that inhibits bacterial cell wall synthesis, effective against gram-positive, negative, and anaerobic, which is just like meropenem. The second drug is cilastatin, added to prevent degradation of imipenem by renal enzyme dehydropeptidases, increasing its effectiveness and reducing kidney toxicity. So it's more helpful than meropenem and less side effects. The dose for Tynum is imipenem is 100 mg per kg per day. It is also given TDS. The next is piperacillin plus tazobactam. The brand name is Tenzo. Piperacillin is a broad spectrum extended spectrum penicillin, effective against gram-positive, gram-negative, and anaerobic bacteria, including Pseudomonas. Tazobactam is a beta-lactamase inhibitor that protects piperacillin from enzymatic degradation, Used for moderate to severe infections like pneumonia, intra-abdominal infections, and sepsis. Works by inhibiting bacterial cell wall synthesis. So it is used for severe infections. The dose for tazobactam plus piperacillin is 100 mg per kg per dose. It is given TDS. The formulations are 1.5 gram by 15 ml and 4.5 gram in 45 ml injection. The next is linezolid. It is also very commonly used in infants. The brand names are Icacil, Nezkil, Nazocin. It is an oxazolidinone antibiotic used for serious gram-positive infections, including MRSA, VRE, and pneumonia. It works by inhibiting bacterial protein synthesis by binding to the 23S ribosomal subunit of the 50S ribosomal subunit, preventing formation of the initiation complex, can cause bone marrow suppression, peripheral neuropathy, and serotonin syndrome with SSRI. So it is important to remember the side effects. It is a great antibiotic, but it is important to keep in mind these side effects. The dose of linezolid IV or oral is 10 mg per kg per dose or 20 to 30 mg per kg TDS. The formulation in injection is 300 mg by 300 ml and the syrup is 100 mg by 5 ml. So the 30 mg, 20 to 30 mg is dose. You can calculate according to the weight. The next is vibramycin, doxycycline. Vibramycin, it is very good for, I think, ENT infections. It comes, I think it also comes in inhalation form. A tetracycline class antibiotic used to treat a wide range of infections, acne, respiratory infections, STI, malaria, prophylaxis, and rickettsial disease. It works by inhibiting bacterial protein synthesis, avoiding pregnancy and children. Yeah, it is teratogenic and should not be given in pregnancy or children under 8 years due to teeth discoloration and bone infects. Well, it is good for chlamydia, malaria, prophylaxis, and rickettsial disease. Well, it's not very commonly used, but still we will see the dose. The dose will be 4 mg per kg BD, and the strength of capsule is 50 mg and 100 mg. The next is ATT, anti-tuberculosis therapy, which has 4 drugs most commonly. The short form is IREP, isoniazid, rifampin, ethambutol, and pyrazinamide. Streptomycin should not be here. It is given if pyrazinamide is not very effective or patient is allergic to isoniazid or rifampin. Let's check the dose. The easy way to remember the dose is 10, 15, 20, 30. 10, 15, 20, 30. Isoniazid is 10 mg, rifampin 15, ethambutol 20, and pyrazinamide is 30. Yeah, the brand name for these medicine is Myrin P. 1 tablet for every 10 kg first 2 months. Then Myrin 1 tablet for every 15 kg before breakfast next 7 months. And the Vita 6 is given. It is a vitamin. It is given to prevent the side effects, which is half tablet for less than 1 year and 1 tablet more than 1 year. Sorry, it is not a vitamin. It is not a vitamin. Let me check it. Vita 6, half tablet less than 1 year and 1 tablet more than 1 year. Oh yeah, sorry, I was right. It is B6 pyridoxine to prevent the nerve degenerations. The syrup isoniazid 50 mg by 5 ml, syrup rifampin is 100 mg by 5 ml and 50 mg, two strength 100 mg and 50 mg, and syrup pyrazinamide is 250 mg by 5 ml. The next is Arceva anti-malarial, malarial, very commonly used, and it is very helpful in malarial infections, suspected malarial infections, and it is used a lot when there is no known cause of infection, no source have been found, then mostly doctors suspected it to be malarial and start this medicine. Arceva is a brand name anti-malarial medication that combines artemether and lumefantrine in various formulations: 20 by 120 mg, 40 by 240 mg, 80 by 480, 20 120, 40 240, 80 480. You can double the doses. Just remember 20 120 and you can double it. So to treat uncomplicated and resistant Plasmodium falciparum. So it is only good for Plasmodium falciparum bacteria, malaria, not the other malaria. Mechanism: artemether generates free radical that rapidly kills malaria parasites within red blood cells. Lumefantrine prolongs antimalarial activity to prevent relapse. So it prevents from happening again, and it artemether kills the malaria by producing radicals, oxygen radicals that kills the parasite. Indication used for acute uncomplicated including chloroquine resistant and sometimes severe or cerebral malaria. Dosage forms, we will check the dose there. Side effects, you can pause the video and read the side effects and contraindication. Let's check the dose. Average is 4 mg per kg per day. The oral dose is 1.5 to 9 mg. You can say it's very variable, starting from 1.5 and going to 9 mg per kg per day. Now we will see how we will give. First dose followed by second dose 8 hour and then BD. So you will give first dose and then after 8 hours you will give second dose, and then next days you will give it BD, mean 12 hourly. So it will be 3 days and 6 doses. The syrup formulations are 50 mg plus 90 mg by 5 ml. Again you can double it, 30 mg plus 180 mg by 5 ml. It is given, the injection is given IM 3.2 mg per kg stat, then 1.6 mg per kg daily for 3 days. Injection strength is 80 mg per ml. Next is chloroquine. It is again an anti-malarial.